Hi folks, welcome to our video series on Chapter 12, Designing Indirect Pay Plans. So here in this chapter we're going to look at major categories of benefits and specific types of benefits included in each category, discuss some of the advantages and disadvantages to fixed, semi-fixed, and flexible plans, and look at some of the issues that we have to address when we as HR professionals are designing an employee benefit system. Now, what are some of the types of benefits and services that organizations offer? Well, first of all, there's mandatory ones, which are really more like your Canada Pension Plan, EI, workers' comp, those kinds of things, which the government mandates employers contribute to. So employers, depending on the size of their payroll, have to make contributions into the plan. But again, these are required. So these also have to factor into our costs when we're looking at the amount of our operating budget that's used up when we look at the cost of compensation. We also have to look at retirement income benefits. Those are pension plans. And again, they can be of two different types, contributory and non-contributory plans. They can be defined benefit, defined contribution plans, so we'll talk a little bit about that when we get to that section. We also have to look at our health care benefits, which could be your medical, your dental, as well as pay for time not worked. Now, some people might fit things in here like flex time, vacation time, could even have long-term disability in here because you're getting paid while you're not working. Employee services could be things like wellness programs, having yoga at the lunch hour, could be things like counseling services, EAP programs or employee assistance programs, those kinds of things. And then other miscellaneous benefits that some organizations offer. Those miscellaneous benefits could be things like tuition reimbursement if you take courses and the employer decides to subsidize them or pay for them. Maybe if you work in a factory environment, you're going to get your work equipment or your safety clothing paid for. Some of them as well might even deal with some employers might even offer things like, say you work at a mall or something like that. If you work in a store, you might get discounts at the store you work at. You might also get discounts at other stores in the mall that you don't work at. So those kinds of things could be seen as some kind of perk or miscellaneous benefit. Now, your mandatory benefits, as we've said, are your Canada Pension, your employment insurance, as well as your workers' compensation. Your retirement benefits, well, I guess I just want to go back here for a minute. Your Canada Pension, employment insurance, and workers' comp. Again, for Canada Pension and EI, employment insurance, your employees also contribute to that. But where we have Canada Pension, don't forget that employers, their contribution rate is different than that of employees, right? So, or it's the same, I should say, as employees. So there is a maximum, right? But for every dollar you put in, the employer matches the contribution, and there is a maximum based on the amount of pay that an individual makes. So payroll people have to know that when the employee reaches their maximum contribution level, meaning based on their pay, the employer and the employee no longer contribute to Canada Pension. And that will change annually as the tax legislation changes. Employment insurance, again, for every dollar you put forward, the company puts in $1.40 to contribute toward that. And again, it's based on your pay. And workers' comp, it's going to cover treatment expenses and costs for workers who are injured on the job. But again, it's not funded by the employees per se, it's more funded by the employer. And the Workers' Compensation Board, or WSIB, Workers' Safety and Insurance Board, it has different names depending on what province you're in. They will determine based on your industry type and your history with work-related accidents what your rate assessment is going to be and how much you'll have to pay. So there's obviously a lot of work being done on the workers' comp front, and there are a lot of specialists in this area who work in this area as consultants to try and advise companies not just on health and safety legislation and how it should be applied and what safe work practices are, but also how to deal with the workers' comp board and how to whittle away perhaps at your premiums, those kinds of things. Now, if we go to the retirement income benefit side, we have defined benefit plans, which are actually telling employees or saying to employees, As you get closer and closer to retirement, we are going to give you a fixed benefit. So in other words, say you're 55 years of age and you say, hey man, I might retire in about 5 or 10 years from now. I wonder what my pension would be. Well, you can go on to your pension provider's website. Usually that might be a company like Sun Life or whatever, whoever's managing your plan. If you're a teacher, it might be your teacher's pension plan. If you're in a college environment, it might be your CAT plan, caat.on.ca. Sometimes you'll have to have your username and password to log in, but they can also help you determine that if your pay stayed at the same level that it was now, and you got to 65, assuming full-time service, what would your pension be? So companies are making a commitment up front to pay your particular pension depending on when you decide to retire. Whereas defined contributions defined contribution plans don't do that. Defined benefit plans leave all the risk with the employer. So the employer now is always paying catch up based on the parameters of the plan to make sure that they have enough money put aside to pay you the pension that they promised to pay you. Whereas in defined contribution plan, nobody is guaranteeing you a predefined benefit or a defined benefit at retirement. Nobody's telling you what that's going to be. Many employers now have developed company-sponsored saving plans and supplemented it with contributions to develop what we call group RSPs. That might be an example of a defined contribution plan whereby you might put in some money and the company might put in some money toward this plan, but they're not guaranteeing you what it's going to earn. The nice thing about these plans here, defined contribution, is that should you terminate before you decide to retire, you can take those contributions with you and you can transfer them into a locked-in RSP. The government allows for that. So you can transfer that into your own personal RSP plan. So that's kind of nice. Now, your pension plans can be what we call hybrid plans, all right, which means a combination of a defined benefit and a defined contribution plan. So, for example, some firms have a defined benefit plan, but they may allow you, depending on your level in the company, to contribute to a different kind of a plan, more of a defined contribution plan. Some companies have both, some companies only have one. Now, we're going to look here at the experience that some companies or that we have had generally with pension plans. I'm sure you can understand that it makes sense if I said, having a pension plan is a very important thing that people look for in a job. Your benefits, including your pensions, is a very important carrot to lure people to come to you, to take up employment, and also to retain employees. So, what we find in the research, interestingly enough, is that employers that have pensions have lower employee turnover than those employees who retire, than their employees retire earlier, and their employees retire earlier than those at firms without plans. So in other words, once employees have an idea of how much they have saved up for retirement, whether or not they choose to work after that or stay the limit, all right, and maybe stay to 65 or 70 or whatever else, that's really going to depend on what they know they already have. So defined benefit plans are really good for that. Defined contribution plans may not be as good for that, but at least you'll have a statement showing what your contributions have bought and what they're worth today in today's dollars. So I guess the idea is that if you want to attract people to work for you, and you want to retain, you're better off offering some kind of a plan, whether it's a defined benefit or a defined contribution plan. Clearly, the defined benefit plan will motivate people to stay with your company once they've been there a while, so it kind of rewards longer service. But if you're in a defined contribution plan, knowing that you can take those contributions with you and transfer them into a locked-in RSP at their full dollar value is even better if you're a younger person and you don't plan to stay with organizations for a very long period of time. So there's different research associated with pension plans, and this I thought was an interesting thing to share with you. Now, if we look at health benefits, we have supplemental health benefits. All right, dental and disability insurance, life and accident insurance, and healthcare spending accounts or flexible benefits. So we'll talk about each of these in turn. If we're looking at supplemental health insurance, we're looking at what we call Medicare or company-sponsored as well as government-sponsored medical coverage. That's your health coverage. Interestingly enough, I didn't know this, but in the States, where government-sponsored universal medical coverage doesn't exist, employers are expected to bear the cost of medical insurance. Now, I don't think that they necessarily mean they're expected to top it up so that everything is covered, but you can imagine the more that an employer took on to cover, they'd probably want to share that cost with employees. They wouldn't be paying for it on their own. So it could be, even if there is government-sponsored medical care, the costs to companies in the United States can actually be way out of sight. If we look at different kinds of health care benefits, we're also looking at disability insurance, which provides you with long-term disability if you cannot come to work as a result of a disability that you've incurred. So say, for example, you have a heart attack. Okay, so it doesn't necessarily have to be for work-related injury, because that would be a compensation or workers' comp, right? So we're looking for non-work-related cases like maybe back injury, even if it's not related to work, heart attack, cancer, those kinds of things. Employers also offer life and accident insurance. So again, most employers, not all, but most will offer you 1 times your salary. All right, to get the benefit. And we typically tend to find with that is that employees don't have to pay the premium on that. But just know that any premium that you would have paid, or whatever the employer is paying on your behalf to get 1 times your salary, if they do that, in Canada at this point, it's a taxable benefit to you. So whatever your employer is paying to give you that 1 times your salary as life insurance, will probably be taxable to you, all right, because you're not paying for it. And again, if you decide to buy over and above life and accident insurance more than 1 time, you can buy 2 times, 3 times. It depends on your company's plan, and usually you're paying for that. Now, you can also have dental care coverage. Now, dental care has become a rapidly expanding benefit in a lot of employer portfolios, but more so one that an employee makes a decision they're either going to join or not. So in other words, employees are looking very, very carefully at the availability of dental care and the amount of dental care they get when they decide to join or even stay with a company. So it's become very, very popular because dental coverage isn't provided under your normal health care, and it can be a major expense. And we know that there's some like orthodontic services for children. It doesn't necessarily have to be even for dependent children. Adults use it as well, but it can become quite costly. So depending on what you need in dental, we know the costs are exorbitant. So it could be that employees, when they decide where they want to work, are using this as a way to determine, where they're going to work, because the benefit has become more expensive over time, and very much desired because it's not covered under your medical plan, the government medical plan. Now, this is a little table here, and I don't want to belabor it. It talks about a lot of different pension and health plans. It talks about their tax status. I just wanted to focus on long-term disability here because so this column here says, is the benefit payout taxable to employees? It says yes and no, and that might be a little bit confusing. I think one of the things I've found over time is that more employers are choosing not to pay for long-term disability for employees. So in other words, they're not paying the premium for you or any part of the premium. Some of the reasons why is not because your employer is a mean person. It's because Canada Revenue Agency sometimes changes their rules and how they're going to treat certain benefits, and therefore employers and HR professionals need to be aware of what the government's doing so you can decide how to position a lot of your benefit offerings. So with the case of LTD, or long-term disability insurance, what happens is that If the employer is not paying the premium to keep that coverage and you are, if you should need to collect from it at some point in time, you collect your benefit on long-term disability insurance, but you don't pay any tax on it. Many employers think that's a better deal because say your long-term disability plan is only covering, say, 60 or 65% of what you used to make when you were working and you can't work anymore, right, or for an extended period of time. You're already going to be working on a reduced salary. But if you've been paying your LTD premiums on your own, they're not going to tax it. The government's not going to tax it. So it's better for you in some cases if you need the coverage because, like I said, you're already not able to work. You're probably depressed about that. Probably the nature of your illness is even depressing you more. So, people don't want to have to pay tax on already reduced income. So there are reasons why employers may make you pay for certain benefits like long-term disability because they may be thinking of the tax benefit to you if you should have to collect. Now, pay for time not work, always a popular one. Vacations, God knows we all need those, right? Things like family day, parental leaves, your maternity leave, education and sabbatical leaves, very popular in the public sector, as well as severance pay. So when you leave an organization, if an organization is trying to motivate you or entice you to leave, they may give you a little severance package to go. I'm sure many of you out there are very familiar with that concept. All right? So you have to decide here now what you want to include. Again, many of these are dictated by the government, right? There's a minimum for severance pay. Nobody says you have to have education and sabbatical, but many times if you're a teacher or you're a nurse, it might be covered under a collective labor agreement. Parental leaves, again, are dictated through the government legislation under employment standards. Supplemental unemployment benefits, this is something that's different, and it may be under some union contracts. I know I worked for a place and we were unionized, and what happened is that if our plant was shut down for any significant period of time, say there was fire or some kind of damage done to the factory, what we had done was negotiate with our union a supplemental unemployment benefit. And what that did is it ensured that the workers would get a certain percentage of their pay even while they weren't working. So at our time, where I worked, the employer would fund part of it and the employee would fund the other part of it. So it was a shared thing. And in fact, when I used to work at one particular company, we had to use it because we had a flood. We had an early thaw one winter, and based on where we were located, all the water kind of pooled in our factory, and it flooded our facility, and we needed to be closed down for a period of time. Now, we did get some of our employees, our factory workers, to help clean up, but we had to pay them their salary because they couldn't do their actual jobs. They were helping us clean up. We had to pay them out of our SUB plan. So some of those kinds of things you will find that employers have, and some of them are negotiated in collective labor agreements, some of them just offered through government, and some of them just offered by employers. Let's look at certain employee services, another part of your indirect benefit package, but we're going to do this in our next video. Okay, so when we come back, we're going to be looking at employee services. So hope you enjoyed the first video and come back for the second.